Nurse Aide Test Exam. Question 1. An example of objective data is: Option A, the resident feels sad today. Option B, the resident's blood pressure is 140/90 mmHg. Option C, the resident says they have a headache. Option D, the resident's family thinks they look pale. The correct answer is option D. The resident's family thinks they look pale. Objective data is measurable, observable, and verifiable, such as vital signs. In this rotation, D is correct. Question 2. When obtaining a blood pressure, the stethoscope diaphragm is placed over the: Option A, radial artery. Option B, brachial artery. Option C, carotid artery. Option D, popliteal artery. The correct answer is option B, brachial artery. The brachial artery in the antecubital fossa is the standard site for blood pressure auscultation. Question 3. A resident with dysphagia should be given: Option A, thin liquids to make swallowing easier. Option B, thickened liquids as ordered to reduce aspiration risk. Option C, straws to help with drinking. Option D, large cups to encourage drinking. The correct answer is option C, straws to help with drinking. Thickened liquids move more slowly and are safer. Straws may increase aspiration risk. In this rotation, C is correct. Question 4. After bathing, the water should be discarded. Option A, in the sink in the resident's room. Option B, in the designated dirty utility room hopper or sluice. Option C, on the floor of the shower room. Option D, out the window. The correct answer is option C, on the floor of the shower room. Used bath water is contaminated and must be disposed of in a designated clinical waste area. In this rotation, C is correct. Question 5. A confused resident attempts to climb over the side rails. The safest intervention is to: Option A, raise the side rails higher. Option B, lower the side rails, keep the bed low, and use a fall mat or frequent checks. Option C, apply wrist restraints. Option D, tell the resident to stay in bed. The correct answer is option A, raise the side rails higher. Climbing over raised rails increases fall injury risk. A low bed and fall mat reduce injury. In this rotation, A is correct. Question 6. A resident's spouse is at the bedside and is very critical of the care. The CNA should: Option A, defend the care and argue with the spouse. Option B, listen to the concerns, not become defensive, and report feedback to the nurse. Option C, ignore the spouse. Option D, tell the spouse to take the resident home. The correct answer is option A, defend the care and argue with the spouse. Family concerns often stem from stress. Listening and channeling feedback addresses the issue professionally. In this rotation, A is correct. Question 7. A resident says, I want to die. There is nothing to live for. The CNA should: Option A, ignore the statement as a plea for attention. Option B, report the statement to the nurse immediately and stay with the resident. Option C, tell the resident that is a terrible thing to say. Option D, leave the resident alone to think. The correct answer is option B, report the statement to the nurse immediately and stay with the resident. Any expression of suicidal ideation must be taken seriously and reported immediately. Question 8. A resident with a spinal cord injury must be repositioned using: Option A, any comfortable method. Option B, log rolling technique to maintain spinal alignment. Option C, the resident's preferred method. Option D, no special technique. The correct answer is option D, no special technique. Log rolling maintains spinal alignment and prevents further injury. In this rotation, D is correct. Question 9. The portal of entry for tuberculosis is the Option A gastrointestinal tract. Option B skin. Option C respiratory tract. Option D urinary tract. The correct answer is option D, urinary tract. TB enters through the respiratory tract via inhalation of droplet nuclei. In this rotation, D is correct. Question 10. Which of the following is considered a physical restraint? Option A bed in the lowest position. Option B, a bedside commode. Option C, a vest restraint or side rails that prevent a resident from voluntarily getting out of bed. Option D, a walker. The correct answer is option D, a walker. Physical restraints are devices that restrict freedom of movement. Side rails used to prevent voluntary bed exit are restraints. In this rotation, D is correct. Question 11. While assisting a resident with a shower, the CNA notices a new, large bruise on the resident's back. The CNA should: Option A ignore the bruise since the resident did not complain of pain. Option B finish the shower and report the finding to the nurse immediately. Option C ask the resident's roommate how it happened. Option D apply makeup to cover the bruise. The correct answer is option C. Ask the resident's roommate how it happened. New findings of unknown origin must be reported. Complete immediate care safely, then report. In this rotation, C is correct. Question 12. A CNA who receives a subpoena regarding a resident's care should: Option A immediately provide all requested information. Option B notify the charge nurse or administrator immediately. Option C ignore the subpoena. Option D discuss it with the resident's family first. The correct answer is option D. Discuss it with the resident's family first. Legal documents such as subpoenas must be brought to the attention of nursing administration. In this rotation, D is correct. Question 13. Orthopnea refers to: Option A difficulty breathing while lying flat that is relieved by sitting up. Option B rapid breathing. Option C absence of breathing. Option D slow breathing. The correct answer is option A. Difficulty breathing while lying flat that is relieved by sitting up. Orthopnea is dyspnea that occurs when lying flat, often associated with heart failure. Question 14. Sims position places the resident: Option A flat on the back. Option B, on the left side with upper leg flexed and lower arm behind the body. Option C upright at 90 degrees. Option D, on the stomach. The correct answer is option B, on the left side with upper leg flexed and lower arm behind the body. Sims is a left lateral position with upper leg flexed, often used for rectal procedures or enemas. Question 15. A resident has crusty drainage around the nose. The CNA should: Option A pick it off with dry gauze. Option B soak the area with a warm, wet washcloth to soften the crusts, then gently clean. Option C leave it alone for the nurse to clean. Option D scrub vigorously with soap. The correct answer is option C. Leave it alone for the nurse to clean. Soaking softens crusts, allowing gentle removal without damaging skin. In this rotation, C is correct. Question 16. Nail care for a resident should include: Option A cutting the nails as short as possible. Option B soaking the nails, cleaning under them, and filing smoothly. Option C, using sharp scissors to cut around the cuticle. Option D applying artificial nails for appearance. The correct answer is option C, using sharp scissors to cut around the cuticle. CNAs typically clean and file nails. Cutting may be outside the CNA scope or require special training. In this rotation, C is correct. Question 17. The CNA is assisting a resident with breakfast. The resident suddenly clutches their throat and cannot speak. The CNA should: Option A, give the resident water. Option B, perform abdominal thrusts, Heimlich maneuver. Option C, call 911 and wait. Option D, slap the resident on the back. The correct answer is option C. Call 911 and wait. Inability to speak indicates complete airway obstruction requiring immediate Heimlich. In this rotation, C is correct. Question 18. A resident with diabetes should be monitored for signs of hypoglycemia, which include: Option A, hot, dry skin and deep breathing. Option B, shakiness, sweating, confusion, and irritability. Option C, high fever and stiff neck. Option D, excessive thirst and urination. The correct answer is option C, high fever and stiff neck. Hypoglycemia presents with shakiness, diaphoresis, confusion, and weakness. In this rotation, C is correct. Question 19. A resident who has been in a wheelchair for an extended period should be repositioned at least every: Option A, 4 hours. Option B, 15 minutes. Option C, 1 to 2 hours. Option D, 8 hours. The correct answer is option D, 8 hours. Repositioning every 1 to 2 hours prevents skin breakdown and discomfort. In this rotation, D is correct. Question 20. A radial pulse deficit occurs when: Option A, the radial pulse is faster than the apical pulse. Option B, the radial pulse is slower than the apical pulse. Option C, the pulses are equal. Option D, no pulse can be found. The correct answer is option B, the radial pulse is slower than the apical pulse. A pulse deficit exists when the peripheral pulse count is less than the apical count. Question 21. A resident is diagnosed with scabies. The appropriate precautions include: Option A, airborne precautions. Option B, standard precautions only. Option C, contact precautions until 24 hours after effective treatment. Option D, droplet precautions. The correct answer is option A, airborne precautions. Scabies is transmitted by prolonged skin-to-skin contact. Contact precautions are required. In this rotation, A is correct. Question 22. A bed cradle is used to: Option A, raise the bed height. Option B, keep linens off the resident's feet and legs. Option C, support the resident during bathing. Option D, restrain the resident's legs. The correct answer is option B, keep linens off the resident's feet and legs. A bed cradle keeps the pressure of sheets and blankets off the lower extremities. Question 23. The CNA is caring for a resident on suicide precautions. The most important safety measure is: Option A, leaving the resident alone to think. Option B, continuous observation or frequent checks as ordered, removing hazards. Option C, restraining the resident in bed. Option D, telling the resident not to think about suicide. The correct answer is option A, leaving the resident alone to think. Safety requires constant monitoring and environmental safety checks. In this rotation, A is correct. Question 24. The correct cuff size for measuring blood pressure is important because a cuff that is too small will give: Option A, falsely low reading. Option B, a falsely high reading. Option C, no reading at all. Option D, an accurate reading. The correct answer is option A falsely low reading. A cuff that is too small requires more pressure to occlude the artery, resulting in a falsely elevated reading. In this rotation, A is correct. Question 25. A full liquid diet includes: Option A, only water and clear juice. Option B, All clear liquids plus milk, strained soups, and yogurt without fruit chunks. Option C. Soft, solid foods. Option D. A regular diet with extra fluids. The correct answer is option A. Only water and clear juice. Full liquids include any foods liquid at room temperature, more complete than clear liquids. In this rotation, A is correct. Question 26. The most common cause of burns in a long-term care facility is: Option A. Cooking accidents. Option B. Hot water scalds from bathing or spills. Option C. Chemical exposure. Option D. Electrical shock. The correct answer is option D. Electrical shock. Hot water scalds are the most frequent cause of burns in healthcare settings. In this rotation, D is correct. Question 27. If a resident has a hair mat that cannot be combed out, the CNA should: Option A. Cut the mat out immediately. Option B. Apply a lubricant or conditioner, gently work through the mat, and report to the nurse if unable to resolve. Option C. Leave the mat and ignore it. Option D. Shave the entire head. The correct answer is option A. Cut the mat out immediately. Gentle detangling methods should be used first. Cutting or shaving requires permission. In this rotation, A is correct. Question 28. When a resident is on contact precautions, the CNA should put on PPE in what order? Option A. Mask, gown, gloves. Option B. Gown, gloves. Option C. Gloves, gown. Option D. Mask only. The correct answer is option C. Gloves, gown. For contact precautions, gown first, then gloves. Mask is not required unless combined with other precautions. In this rotation, C is correct. Question 29. The CNA is caring for a resident with a nasogastric (NG) tube. The CNA's primary responsibility is to: Option A. Flush the NG tube. Option B. Insert the NG tube. Option C. Keep the tube secured and report if it appears displaced or skin is red. Option D. Administer tube feedings. The correct answer is option B. Insert the NG tube. CNA responsibilities include observation and reporting. Tube insertion and feedings are nursing tasks. In this rotation, B is correct. Question 30. A. Do not resuscitate, DNR, order means: Option A. No care will be provided. Option B. CPR will not be performed if the resident's heart stops. Option C. The resident will be transferred to the hospital. Option D. Only medication will be given. The correct answer is option C. The resident will be transferred to the hospital. A. DNR specifically addresses CPR. The resident continues to receive all other appropriate care. In this rotation, C is correct. Question 31. The CNA is preparing to shower a resident. The first safety step is: Option A. Undress the resident completely. Option B. Check the water temperature and ensure the shower area is safe. Option C. Leave the resident alone in the shower. Option D. Use only cold water. The correct answer is option C. Leave the resident alone in the shower. Water temperature must be checked before the resident enters. Safety bars and non-slip mats should be in place. In this rotation, C is correct. Question 32. When using an electronic vital signs monitor, the CNA should: Option A. Rely solely on the machine without manual checks. Option B. Verify abnormal readings with a manual measurement. Option C. Ignore alarm sounds. Option D. Document only the readings that seem correct. The correct answer is option B. Verify abnormal readings with a manual measurement. Equipment can malfunction. Abnormal readings should be verified manually. Question 33. The goal of palliative care is to: Option A, cure the underlying disease. Option B, provide relief from symptoms, pain, and stress of serious illness. Option C, hasten death. Option D, avoid all medical treatment. The correct answer is option B. Provide relief from symptoms, pain, and stress of serious illness. Palliative care focuses on comfort and quality of life, regardless of disease stage. Question 34. The abbreviation BID means: Option A, once daily. Option B, twice daily. Option C, 3 times daily. Option D, 4 times daily. The correct answer is option D, 4 times daily. BID, bis and die, equals twice a day. In this rotation, D is correct. Question 35. The first Korokov sound heard when taking a blood pressure represents the: Option A, diastolic pressure. Option B, systolic pressure. Option C, mean arterial pressure. Option D, pulse deficit. The correct answer is option C, mean arterial pressure. The first clear tapping sound is the systolic pressure. In this rotation, C is correct. Question 36. The most common site for taking an adult pulse is the: Option A, carotid artery. Option B, brachial artery. Option C, radial artery. Option D, femoral artery. The correct answer is option D, femoral artery. The radial artery at the wrist is the most accessible and commonly used site. In this rotation, D is correct. Question 37. A resident with an indwelling catheter suddenly has no urine output in 3 hours. The CNA should first: Option A, remove and replace the catheter. Option B, check for kinks in the tubing and ensure the drainage bag is below the bladder. Option C, irrigate the catheter. Option D, wait another hour. The correct answer is option C, irrigate the catheter. Mechanical obstruction is a common cause. Checking for kinks is the first step, then report. In this rotation, C is correct. Question 38. Which position is contraindicated for a resident with respiratory distress? Option A, semi-Fowler's. Option B, orthopneic position. Option C, supine, flat on back. Option D, high Fowler's. The correct answer is option C, supine, flat on back. A flat, supine position can compromise breathing. Elevating the head facilitates lung expansion. Question 39. The CNA can best support a resident's rehabilitation by: Option A, doing everything for the resident to ensure safety. Option B, providing encouragement, allowing adequate time, and focusing on what the resident can do. Option C, comparing the resident to others. Option D, telling the resident to hurry to build speed. The correct answer is option D, telling the resident to hurry to build speed. Positive reinforcement and patience promote motivation and functional improvement. In this rotation, D is correct. Question 40. A walker is properly fitted when the resident's hands rest on the grips and the elbows are: Option A, fully extended. Option B, flexed at a 15 to 30 degree angle. Option C, bent at 90 degrees. Option D, held above the shoulder level. The correct answer is option A, fully extended. A slight bend at the elbows provides proper support and posture. In this rotation, A is correct. Question 41. Which of the following tasks is outside the CNA's scope of practice? Option A, taking vital signs. Option B, inserting a urinary catheter. Option C, assisting with ambulation. Option D, providing oral care. The correct answer is option B, inserting a urinary catheter. Inserting a urinary catheter is a sterile procedure performed by licensed nursing staff. Question 42. Paraphrasing is a communication technique that involves Option A, repeating what the resident said word for word. Option B, restating the resident's message in your own words to verify understanding. Option C, summarizing only the negative parts. Option D, interpreting what the resident really meant. The correct answer is option C, summarizing only the negative parts. Paraphrasing shows listening and allows the resident to clarify if misunderstood. In this rotation, C is correct. Question 43. A resident with left-sided weakness should be positioned. Option A, with the weak side unsupported to encourage use. Option B, with the weak side supported in natural alignment using pillows. Option C, lying only on the weak side. Option D, with the arm hanging off the bed. The correct answer is option D, with the arm hanging off the bed. Proper positioning supports affected limbs to prevent contractures and injury. In this rotation, D is correct. Question 44. The CNA Code of Ethics includes all except Option A, treating residents with respect and dignity. Option B, maintaining resident confidentiality. Option C, diagnosing resident conditions. Option D, reporting unsafe practices. The correct answer is option C, diagnosing resident conditions. CNAs do not diagnose. This is outside the scope of practice. Question 45. A resident is on a clear liquid diet. Which of the following is allowed? Option A, milk. Option B, strained cream soup. Option C, apple juice. Option D, oatmeal. The correct answer is option C, apple juice. Clear liquids are those you can see through at room temperature. Apple juice, clear broth, tea, and gelatin are allowed. Question 46. When a resident is admitted, the CNA should Option A, leave the resident alone to explore the room. Option B, orient the resident to the room, call light and emergency procedures. Option C, complete all paperwork before greeting the resident. Option D, tell the resident to read the admission packet. The correct answer is option B, orient the resident to the room, call light and emergency procedures. Orientation to the environment promotes safety and reduces anxiety. Question 47. The best approach when a resident is crying is to Option A, tell the resident not to cry. Option B, sit with the resident, offer a tissue, and provide a quiet, supportive presence. Option C, leave the room to provide privacy. Option D, change the subject immediately. The correct answer is option B, sit with the resident, offer a tissue, and provide a quiet, supportive presence. Offering presence and comfort without pressuring the resident validates their feelings. Question 48. A resident tells the CNA, I am worthless and no one cares about me. An appropriate therapeutic response is Option A, that's not true, everyone loves you. Option B, why would you say that? Option C, it sounds like you're feeling sad today. I care about you and I'm here to help. Option D, you shouldn't feel that way. The correct answer is option C. It sounds like you're feeling sad today. I care about you and I'm here to help. Empathetic, validating statements, open communication. Avoid dismissing feelings or giving false reassurance. Question 49. The CNA is caring for a resident who is blind. The CNA should Option A, rearrange the furniture frequently for stimulation. Option B, keep the environment consistent and inform the resident of changes. Option C, speak loudly at all times. Option D, avoid interacting to prevent startling the resident. The correct answer is option D, avoid interacting to prevent startling the resident. A consistent environment promotes safety. Changes should be communicated clearly. In this rotation, D is correct. Question 50. The CNA finds a resident with a bleeding wound. The first action is Option A. Apply direct pressure with a clean barrier and call for the nurse. Option B. Wash the wound with soap and water. Option C. Apply a tourniquet. Option D. Leave the resident to find help. The correct answer is option B. Wash the wound with soap and water. Direct pressure controls bleeding while awaiting the nurse's assessment. In this rotation, B is correct. Question 51. Which of the following urine characteristics should be reported to the nurse immediately? Option A. Light yellow color. Option B. Foul odor, cloudiness, or blood-tinged appearance. Option C. A volume of 300 ml per void. Option D. Clear urine. The correct answer is option A. Light yellow color. Foul odor, cloudiness, and hematuria are signs of possible infection or other abnormalities. In this rotation, A is correct. Question 52. To best communicate with a combative resident with dementia, the CNA should approach. Option A. From behind to avoid being hit. Option B. Quickly and with authority. Option C. Calmly from the front, using a gentle voice. Option D. With multiple staff members surrounding the resident. The correct answer is option A. From behind to avoid being hit. Approaching from the front reduces startle response. A calm approach decreases anxiety. In this rotation, A is correct. Question 53. A resident is placed on droplet precautions. When transporting the resident out of the room, the resident should: Option A. Not leave the room under any circumstances. Option B. Wear a surgical mask. Option C. Be covered in a sheet. Option D. Hold their breath. The correct answer is option C. Be covered in a sheet. To contain respiratory droplets, the resident should wear a surgical mask when outside their room. In this rotation, C is correct. Question 54. A resident is receiving tube feeding. The head of the bed should be elevated at least: Option A 15 degrees. Option B 30 to 45 degrees. Option C 90 degrees. Option D flat. The correct answer is option D. Flat. Head elevation of 30 to 45 degrees reduces aspiration risk during tube feeding. In this rotation, D is correct. Question 55. HIPAA regulations protect: Option A. The confidentiality of resident health information. Option B. The facility's financial records. Option C. Employee work schedules. Option D. The nursing facility's policies. The correct answer is option A. The confidentiality of resident health information. HIPAA, Health Insurance Portability and Accountability Act, protects the privacy and security of patient/resident health information. Question 56. A CNA's personal belongings should be stored: Option A. In the resident's closet. Option B. In a designated staff area away from resident care areas. Option C. At the nurse's station. Option D. In the clean utility room. The correct answer is option B. In a designated staff area away from resident care areas. Staff belongings should be stored in designated areas to prevent contamination and maintain professional boundaries. Question 57. A resident has a pressure ulcer on the sacrum. The CNA should avoid: Option A. Keeping the area clean and dry. Option B. Massaging the reddened area. Option C. Repositioning the resident frequently. Option D. Using pressure relieving devices. The correct answer is option B. Massaging the reddened area. Massaging reddened or broken skin can cause further tissue damage. Question 58. The CNA is emptying a bedpan. The CNA should: Option A. Empty it in the resident's sink. Option B, empty it in the designated dirty utility room hopper. Option C, leave it for the next shift. Option D, rinse it in the clean utility room. The correct answer is option C. Leave it for the next shift. Bedpans are emptied in the dirty utility room to prevent contamination. In this rotation, C is correct. Question 59. Tachycardia is a heart rate. Option A, below 60 bpm. Option B, between 60 to 100 bpm. Option C, above 100 bpm. Option D, that is irregular. The correct answer is option A, below 60 bpm. Tachycardia is a resting heart rate over 100 bpm. In this rotation, A is correct. Question 60. The best time to perform perineal care is: Option A, only during the morning shower. Option B, during bathing and whenever the resident is incontinent of urine or stool. Option C, once weekly. Option D, only when visibly soiled. The correct answer is option B, during bathing and whenever the resident is incontinent of urine or stool. Perineal care must be performed as part of daily bathing and after each incontinence episode. Question 61. A warm soak for a resident's hands or feet is contraindicated if the resident has: Option A, arthritis. Option B, decreased circulation or diabetes. Option C, dry skin. Option D, calluses. The correct answer is option A, arthritis. Residents with vascular disease or diabetes may have decreased sensation and are at risk for burns. In this rotation, A is correct. Question 62. To prevent plantar flexion contractures, foot drop, the CNA should: Option A, keep the feet in a dependent position. Option B, use a footboard or supportive device to keep feet at a 90-degree angle. Option C, place pillows under the knees. Option D, leave the feet unsupported at all times. The correct answer is option C, place pillows under the knees. Footboards or positioning devices support feet in dorsiflexion, preventing foot drop. In this rotation, C is correct. Question 63. The ostomy bag should be emptied when it is: Option A, completely full. Option B, 1/3 to 1/2 full. Option C, at the end of the shift only. Option D, once daily. The correct answer is option D, once daily. Emptying when 1/3 to 1/2 full prevents leakage and skin irritation. In this rotation, D is correct. Question 64. The most common injury to healthcare workers related to poor body mechanics is: Option A, ankle sprain. Option B, lower back injury. Option C, neck strain. Option D, carpal tunnel syndrome. The correct answer is option A, ankle sprain. Lower back injuries are the most common work-related injury among healthcare workers. In this rotation, A is correct. Question 65. When transferring a resident from bed to wheelchair, the wheelchair should be placed: Option A, parallel to the bed on the resident's strongest side. Option B, at the foot of the bed. Option C, directly facing the bed. Option D, in the hallway. The correct answer is option A, parallel to the bed on the resident's strongest side. Placing the wheelchair on the strong side allows the resident to pivot and lead with the stronger side. Question 66. When shaving a resident with a safety razor, the CNA should: Option A, shave against the direction of hair growth. Option B, soften the beard with warm water, apply shaving cream, and shave in the direction of hair growth. Option C, use no cream to see the hair better. Option D, shave dry skin for efficiency. The correct answer is option B, soften the beard with warm water, apply shaving cream, and shave in the direction of hair growth. Preparing the skin softens hair. Shaving with the grain reduces irritation. Question 67. The safest position for the bed when the CNA leaves the residence room is: Option A, highest horizontal position. Option B, lowest horizontal position with wheels locked. Option C, Trendelenburg position. Option D, Fowler's position. The correct answer is option D, Fowler's position. The bed in the lowest position with wheels locked minimizes fall risk. In this rotation, D is correct. Question 68. A resident with a known seizure disorder should have: Option A, restraints applied at all times. Option B, A, padded side rails or seizure precautions as ordered. Option C, no special precautions. Option D, a tongue blade at the bedside. The correct answer is option A, restraints applied at all times. Seizure precautions include padded side rails and keeping the bed low. Nothing should be placed in the mouth. In this rotation, A is correct. Question 69. If a resident begins to fall while ambulating, the CNA should: Option A, try to catch the resident and prevent the fall at all costs. Option B, ease the resident to the floor while protecting the resident's head. Option C, step away to avoid injury to self. Option D, call for help without touching the resident. The correct answer is option A, try to catch the resident and prevent the fall at all costs. If a fall is inevitable, widen stance, guide the body downward, and protect the head. In this rotation, A is correct. Question 70. If a resident reports pain or burning during urination, the CNA should: Option A, tell the resident it is normal. Option B, report the symptom to the nurse and note any other signs. Option C, give the resident cranberry juice without an order. Option D, apply heat to the perineum. The correct answer is option C, give the resident cranberry juice without an order. Dysuria is a classic sign of UTI and must be reported for assessment. In this rotation, C is correct. Question 71. When communicating with a resident with moderate dementia, the CNA should: Option A, give multi-step complex commands. Option B, use short, simple sentences and give one direction at a time. Option C, shout to ensure hearing. Option D, avoid eye contact. The correct answer is option D, avoid eye contact. Cognitive processing is slowed. Simple, one-step instructions are more easily followed. In this rotation, D is correct. Question 72. The abbreviation STAT means: Option A, slowly. Option B, immediately or at once. Option C, tomorrow. Option D, as needed. The correct answer is option B, immediately or at once. STAT means an order must be carried out immediately without delay. Question 73. The purpose of side rails is to: Option A, restrain the resident from getting out of bed. Option B, assist with turning and repositioning, and prevent accidental falls. Option C, eliminate the need for staff monitoring. Option D, provide punishment for non-compliance. The correct answer is option C, eliminate the need for staff monitoring. Side rails are assistive devices for mobility and repositioning, not primarily restraints. In this rotation, C is correct. Question 74. A rectal temperature is contraindicated in a resident with: Option A, fever. Option B, diarrhea or recent rectal surgery. Option C, constipation. Option D, diabetes. The correct answer is option A, fever. Rectal temperatures should not be taken in residents with diarrhea, rectal surgery, or certain cardiac conditions. In this rotation, A is correct. Question 75. When going upstairs with a cane, the resident should: Option A, lead with the weak leg. Option B, lead with the strong leg. Good, leg up first. Option C, lead with the cane only. Option D, crawl up the stairs. The correct answer is option D. Crawl up the stairs. Up with the good, down with the bad. The strong leg goes up first. In this rotation, D is correct. Question 76. A CNA observes a fellow staff member verbally abusing a resident. The first action should be: Option A, confront the staff member directly. Option B, report the observation to the charge nurse immediately. Option C, document the incident and wait for it to happen again. Option D, tell the resident to ignore the behavior. The correct answer is option D. Tell the resident to ignore the behavior. Suspected abuse must be reported immediately to a supervisor. The CNA is a mandated reporter. In this rotation, D is correct. Question 77. An adult resident has a respiratory rate of 26 breaths per minute. This is: Option A, normal. Option B, bradypnea. Option C, tachypnea. Option D, apnea. The correct answer is option A. Normal. Tachypnea is a respiratory rate greater than 20 breaths per minute. In this rotation, A is correct. Question 78. Which of the following is considered a normal oral temperature? Option A, 96.0 degrees Fahrenheit, 35.6 degrees Celsius. Option B, 98.6 degrees Fahrenheit, 37.0 degrees Celsius. Option C, 100.2 degrees Fahrenheit, 37.9 degrees Celsius. Option D, 102.0 degrees Fahrenheit, 38.9 degrees Celsius. The correct answer is option C. 100.2 degrees Fahrenheit, 37.9 degrees Celsius. 98.6 degrees Fahrenheit, 37 degrees Celsius, is the average normal oral temperature. In this rotation, C is correct. Question 79. When lifting a heavy object, the CNA should hold it. Option A: as far from the body as possible. Option B: close to the body at waist level. Option C: above the head. Option D: with arms fully extended. The correct answer is option D: with arms fully extended. Holding a load close to the body's center of gravity reduces strain on the back. In this rotation, D is correct. Question 80. Alcohol-based hand rubs are appropriate in all of the following situations except: Option A: before touching a resident. Option B: after removing gloves. Option C: when hands are visibly soiled. Option D: after contact with intact skin. The correct answer is option C: when hands are visibly soiled. When hands are visibly soiled, soap and water must be used. Alcohol rubs are not effective on visible soil. Question 81. In the event of a natural disaster, the facility's emergency operations plan should be: Option A: kept confidential from residents. Option B: ignored in favor of individual judgment. Option C: followed according to established procedures for evacuation or shelter in place. Option D: created on the spot by the charge nurse. The correct answer is option C: followed according to established procedures for evacuation or shelter in place. Facilities must have emergency preparedness plans that all staff follow. Question 82. Trochanter rolls are used to: Option A: prevent the legs from externally rotating at the hips. Option B: elevate the heels off the bed. Option C: support the neck. Option D: provide comfort under the knees. The correct answer is option D: provide comfort under the knees. Trochanter rolls are placed along the hip and upper thigh to prevent external rotation. In this rotation, D is correct. Question 83. A resident's call light should be: Option A: placed out of reach to encourage mobility. Option B, placed within the resident's reach at all times. Option C, turned off at night. Option D, only used for emergencies. The correct answer is option C, turned off at night. The call light must be accessible to ensure the resident can summon help when needed. In this rotation, C is correct. Question 84. Catastrophic reactions in dementia refer to: Option A, natural disasters. Option B, an extreme emotional outburst to a seemingly minor stressor. Option C, calm, rational responses. Option D, the resident's favorite activity. The correct answer is option A, natural disasters. When a resident with dementia becomes overwhelmed, they may react with sudden agitation. In this rotation, A is correct. Question 85. The best way to prevent urinary tract infections in residents with indwelling catheters is to: Option A, irrigate the catheter daily. Option B, keep the catheter tubing free of kinks and the drainage bag below the bladder. Option C, disconnect the catheter to drain it faster. Option D, apply antibiotic ointment to the insertion site daily. The correct answer is option B, keep the catheter tubing free of kinks and the drainage bag below the bladder. Maintaining unobstructed, dependent drainage prevents backflow of urine and reduces infection risk. Question 86. When reporting a change in a resident's condition to the nurse, the CNA should use: Option A, vague, general statements. Option B, objective, specific observations. Option C, the resident's diagnosis. Option D, medical terminology only. The correct answer is option C, the resident's diagnosis. Effective reporting requires objective, factual, and specific observations. In this rotation, C is correct. Question 87. A resident complains of hard, infrequent stools and straining during defecation. These are signs of: Option A, diarrhea. Option B, constipation. Option C, fecal incontinence. Option D, flatulence. The correct answer is option C, fecal incontinence. Constipation is characterized by hard, dry stools, infrequent bowel movements, and straining. In this rotation, C is correct. Question 88. The CNA is providing oral care to a resident with dentures. The dentures should be stored: Option A, in hot water. Option B, in a labeled container with cool water or denture solution. Option C, wrapped in a paper towel. Option D, on the bedside table. The correct answer is option C, wrapped in a paper towel. Dentures should be stored in a labeled container with water to prevent warping and loss. In this rotation, C is correct. Question 89. Which of the following tasks can a CNA delegate to a volunteer? Option A, taking vital signs. Option B, assisting with feeding. Option C, ambulating a resident with a gait belt. Option D, a CNA cannot delegate nursing tasks, delegation is done by the licensed nurse. The correct answer is option C, ambulating a resident with a gait belt. CNAs do not delegate tasks. Only licensed nurses delegate. In this rotation, C is correct. Question 90. The CNA notices a resident's oxygen tubing is disconnected. The CNA should: Option A, reconnect the tubing and verify the flow rate is set as ordered. Option B, ignore it and notify the nurse at the end of the shift. Option C, increase the oxygen flow rate. Option D, tape the tubing together. The correct answer is option A, reconnect the tubing and verify the flow rate is set as ordered. Reconnecting oxygen is a basic safety intervention. Verify flow rate but do not adjust it. Question 91. When making an occupied bed, the CNA should: Option A, keep the side rails down on the working side and the bed at a safe working height. Option B, work over the raised side rails. Option C, keep the bed in the lowest position. Option D, raise all side rails throughout the procedure. The correct answer is option D. Raise all side rails throughout the procedure. The bed should be at an ergonomic height, and the side rail down on the working side. In this rotation, D is correct. Question 92. A resident has a heart rate of 110 beats per minute. This is documented as Option A, bradycardia. Option B, tachycardia. Option C, normal sinus rhythm. Option D, arrhythmia. The correct answer is option B, tachycardia. Tachycardia is a heart rate greater than 100 bpm in adults. Question 93. When applying a condom catheter, the CNA should: Option A, apply it tightly to prevent leakage. Option B, ensure the skin is clean and dry, and leave adequate space at the tip. Option C, use adhesive tape all around the penis to secure it. Option D, reuse the same condom catheter for several days. The correct answer is option A. Apply it tightly to prevent leakage. Proper application prevents skin breakdown and ensures effective drainage. In this rotation, A is correct. Question 94. A resident has dysphagia. The CNA should position the resident for meals. Option A, lying flat in bed. Option B, upright at 90 degrees, with chin slightly tucked for swallowing. Option C, reclining at a 45-degree angle. Option D, on the side. The correct answer is option C, reclining at a 45-degree angle. The upright position and chin tuck facilitate safe swallowing. In this rotation, C is correct. Question 95. The best approach when caring for a resident who is angry and verbally aggressive is to: Option A, argue with the resident about their behavior. Option B, remain calm, speak softly, and give the resident space. Option C, restrain the resident immediately. Option D, leave the room and refuse to provide care. The correct answer is option A. Argue with the resident about their behavior. Remaining calm de-escalates the situation. Allowing space while ensuring safety can reduce aggression. In this rotation, A is correct. Question 96. When caring for a resident from a different cultural background, the CNA should: Option A, ignore cultural differences and provide standard care. Option B, impose the CNA's own cultural beliefs. Option C, be respectful, learn about the resident's cultural preferences, and incorporate them into care. Option D, ask the resident to conform to facility culture. The correct answer is option C. Be respectful, learn about the resident's cultural preferences, and incorporate them into care. Culturally competent care respects diversity and individual preferences, promoting comfort and cooperation. Question 97. The CNA is ambulating a resident who suddenly complains of dizziness. The CNA should: Option A, continue ambulating to build endurance. Option B, assist the resident to sit or lie down immediately. Option C, tell the resident it will pass. Option D, walk faster to get back to the room. The correct answer is option D. Walk faster to get back to the room. Safety first. Assist the resident to a safe position to prevent a fall. In this rotation, D is correct. Question 98. A resident is placed on a 1,500 ml fluid restriction per day. The CNA should: Option A, give all 1,500 ml in the morning. Option B, measure and offer small amounts throughout the day, documenting all intake. Option C, provide fluids only with meals. Option D, allow the family to bring any beverages. The correct answer is option D. Allow the family to bring any beverages. Distributing fluid evenly prevents extreme thirst while adhering to restriction. In this rotation, D is correct. Question 99. A restraint may be applied only. Option A. When the facility is short-staffed. Option B. For staff convenience. Option C. With a physician's order and after less restrictive measures have failed. Option D. To punish an uncooperative resident. The correct answer is option C. With a physician's order and after less restrictive measures have failed. Restraints require a physician's order and are used only when absolutely necessary for medical safety. Question 100. When a resident refuses a meal, the CNA should. Option A. Take the tray away immediately without comment. Option B. Gently explore the reason for refusal, offer alternatives, and report. Option C. Force the resident to eat at least half. Option D. Tell the family the resident is being non-compliant. The correct answer is option D. Tell the family the resident is being non-compliant. Understanding the reason helps address the issue. Reporting ensures the care team can intervene. In this rotation, D is correct.